Hello, hello. This is the fifth and final installment of effective prescribing of behavior medicines. I hope you have been using steps 1 through 4. You can find them on YouTube or on LinkedIn. And I hope that you're feeling a lot more confident. And this is the step that often flummoxes people. That's step 5, making changes once you have prescribed. I want to throw at you some little hacks or quick tips that will help you when you're prescribing. Number one, the dosing schedule or the dose will very, very often, I'm going to say maybe 90% of the time, have to be changed in order to abate clinical signs. So, for example, when you prescribe a nonsteroidal anti-inflammatory or an antibiotic, you probably prescribe at the dose you expect to work or pretty close to that dose, right? With a behavior med, it's not always the same way. With a behavior med, you're going to start at the low end. You're always going to use that as your guide, except for emergency situations, okay? So you're going to start at the low end, and you're going to go ahead and slowly increase with an antidepressant every 2 weeks with a short-term medicine like a benzodiazepine or gabapentin. You might increase every 24 to 72 hours. So just expect that and let clients know so that they know exactly what to expect. Next, you need a couple of rules that will help you to know when and how to make changes. So this is my made up rule. This is the 50% rule, but it's worked for me for well over a decade. And when I talk to my colleagues, what I've noticed is that they all have their own versions of this rule, 40%, 60%. So this is our 50% rule. You're going to apply this rule when you have prescribed a medication already, okay? So the client comes back to you and she says, hey, my dog's not any better, or my cat's not any better, or my dog's a little better, but not exactly what I want. So you're just going to ask yourself, and you're going to ask the pet parent as well. You're going to say, hey, did the medication help? Did it do something? Yes or no? And were there any side effects? Because, we never want side effects. So if the answer is no, it didn't help, or let's say it did have side effects, then I'm going to discontinue the medication and try a different medicine. So if I prescribed at a reasonable dose, so let's say I prescribed Reconcile and I got up to 1 milligram per kilo, and I still don't see an appreciable effect, and the dog's been on it for 2 months, or if the dog lost her appetite on the Reconcile, for example, then I'm going to discontinue and move on. What if the answer is yes? What if the dog did improve or the cat did improve on the medicine, just not enough? Then I'm going to ask myself, is the dose at the top of the dosing range? What is the top, you ask? 80%. Probably through the range is a good rule, 80 to 90%. So if you got 80 to 90% to the top of the range for that particular drug, you are considered at the top. Okay. So if you're not at that 80 or 90%, let's go ahead and increase that dose. That drug is helping your patient. Why would you discontinue it and throw it away? Let's say that you are in fact at the top of that dosing range, 80 or 90% of the way. Then you're going to ask yourself, here's where the 50% comes in. You're going to ask yourself, did that medicine help 50%? Did it change the pet's behavior 50%? If the answer is yes, then hang on to that medicine, hold it, and add another medicine in. If the answer is no, then we're going to go ahead and discontinue that medicine. Now, this is a general rule to be applied to general cases. If you have, for example, a dog who bites people and you put that dog on a medicine, you can't expect that medicine to work 50% if the pet parent is continuing to expose that dog to triggers, because medicines aren't magical. They're helpful, but they don't cure behavior problems instantly. So if they're doing nothing else, you might not get 50% with any medicine or any combination. So you're always going to check on those other things, but in general, this should be your expectation of medicines. Most anxiety disorders are going to require some sort of PRN treatment. Why? Because many times the animal cannot escape what causes them anxiety. And you might also say many fear disorders are going to require a PRN treatment. So storm phobia, separation-related disorders, car travel, vet visits, you're probably going to apply a PRN to that. And for most PRNs, you're going to start low and go up, adjusting every 24 to 72 hours. Or if it's like for a vet visit or a car ride, maybe you would adjust after every vet visit or car ride until you found exactly the mixture that you wanted. If you're looking for more information on how to prescribe meds, how to approach behavior cases, this is my new book. It is brand new and updated. It is so easy to read and it's referenced. So that's going to be your best resource. And if you like behavior, consider going to the Veterinary Behavior Symposium preceding ACVIM in Minnesota this year. It is going to be incredible and really fun, super practical, 20-minute lectures. And then finally, if you want to know more about either pain and how it relates to behavior, or how to prescribe medications, or noise phobia, I'm doing a series of lectures. And if you scan the QR code, you'll be brought to the website where you can sign up for any or all of those lectures. I hope that you feel more confident after going through the 5 steps for effective prescribing and get out there and help your behavior patients.